The radiologist actually came in and performed the ultrasound, and I'll never forget his words. He said, "I really don't like what I'm seeing here." Hi, my name is Amber. I'm a patient of Dr. Anjeanette Brown. So I was diagnosed when I had just turned 32. What led to my diagnosis was I had actually just taken a shower. I was standing in the mirror and I had noticed like my left nipple looked different. It didn't look like it normally had. It almost looked like someone pulled the skin back. So I didn't really think anything of it. I did like a self-exam. Either way, I went to my OBGYN, had her check it out. Same thing. She didn't feel anything alarming either, but sent me for a mammogram, ultrasound. So I went and had that done. So I have my mammogram first and then my ultrasound, and they sent me back to the waiting room. And I kind of knew then that things were not good because they didn't say, "Oh, you're good, we'll let you know." They sent me back to the waiting room and said, "Hang on here for a little bit." I waited there and they came back and said, "We need you to come back in. We want to rescan you." The radiologist actually came in and performed the ultrasound, and I'll never forget his words. He said, "I really don't like what I'm seeing here. I want you to go see a breast surgeon." First person I called when I left there was my mom, obviously. And she had actually seen Dr. Brown for something years prior. So she was like, "Absolutely call Dr. Brown." So I left, and that was my second call after my mom was Dr. Brown's office. So I called and they said, "Well, we actually don't have any appointments available for like a month or so." It was a while. And she's like, "But if you could have AMI send over all of your scans and everything, we'll take a look and we'll have Dr. Brown look at them." So I did that. Dr. Brown's office called me back like an hour or two later. She's like, "We need you to come in tomorrow." Tomorrow. So that next day, I came in and met Dr. Brown, and her aura, I want to say, but just the warmth that follows this woman immediately calmed me, just calmed my soul. I don't know what it is about her, but she's an amazing human. With me being so young and having 2 kids, and she was just like, "You should not have this kind of cancer. This is what we call the old lady cancer. You are too young for this." She's like, "I want to do it all." She's like, "I want chemo, double mastectomy, bilateral reconstruction, radiation. You're getting the works. We are knocking this out of you." So I underwent 16 rounds of chemotherapy, and then we did the double mastectomy. A month later, after the double mastectomy, we did the reconstruction, and a month following that is when I began radiation. Recovery is always the hardest part for me, honestly. I'm very active. I love to work out. Having to sit around and do absolutely nothing was one of the hardest things in the world. My overall experience with Dr. Anjeanette Brown and her staff, her main nurse, Danielle, actually has become an amazing friend to me. I met amazing humans who really cared about me, and their ultimate goal was to get me through and get me back to my babies, and I will forever be grateful to them. My advice: take it one step at a time. Don't stress until there's something to stress about. It's so important to have a good relationship with your doctor, and if you don't feel like they care, you gotta go somewhere else. You have to. Don't stop doing the things that you love. Through chemo, I continued to run and work out just as much as I did. Not as well, but I never stopped. Accept the help, because it truly does take a village. And if it wasn't for my amazing family, my incredible friends, and even my work family, my colleagues were so understanding and so helpful, and just, I had the most amazing support squad. And again, I'm just so grateful for them, because I wouldn't have been able to get through it without them. Accept the help.